Hello, thanks for calling Health Partners. My name's Mary. What can I do for you today?
Hi, Mary. My name's Rose. My husband and I turned 65 this year, and we have a lot of questions about Medicare.
Well, Rose, let's dive right in. What's your first question?
I know this might sound silly, but what is Medicare?
Well, simply put, Medicare is a federal health insurance program for U.S. citizens that covers a wide range of services for people who are 65 and older, under 65 with certain disabilities, or have end-stage renal disease if they are over age 18. And Rose, my father used to say there are no silly questions, only silly people. And you are not a silly person. What's your next question?
So, Medicare starts at age 65?
Yep, age 65 is when you're eligible to enroll in Original Medicare, also known as Parts A and B, through the Social Security Administration. Original Medicare only covers the essentials, like hospital costs and medical costs. However, you can also enroll in a private Medicare health plan, where you can get similar coverage and other benefits and perks, as well as prescription drug coverage.
Hey, Mary. Want me to grab you some lunch? Oh, we don't get off the call until they understand it all.
I love my job. Okay, Rose, what's your next question?
So how does Medicare work?
When you enroll in Original Medicare, you pay for medical services as you get them. You'll start by paying a deductible. That's a set amount you pay each year. Once your deductible is met, you usually pay 20% of the cost of each Medicare-approved service, and Medicare pays for the rest. That's called coinsurance. You continue to pay the coinsurance the rest of the year. There's no yearly limit for what you pay out of pocket. Hospital coverage has a separate deductible and a fixed per-day cost, which varies depending on the number of days you stay.
I was wondering, is Medicare mandatory?
Strictly speaking, Medicare isn't mandatory, but you're gonna want it. As I mentioned before, Original Medicare pays for some, but not all of the cost for covered healthcare services and supplies. If you enroll in a private plan, they have their own cost structures and typically have an out-of-pocket limit where the plan pays 100% for covered services the rest of the year, once you hit your annual maximum.
How is Medicaid different than Medicare?
Medicaid is a joint federal and state program that helps cover medical costs for some people with limited income and resources. Medicare is for people of all income levels. You've likely been paying Medicare taxes out of your paycheck most of your life. This question comes up all the time. There are Medicare plans for those that are also eligible for both Medicare and Medicaid. I can guarantee you we'll be talking more about Medicaid in a bit.
If I already have health insurance, do I need Medicare?
You don't need it, but let me explain what would happen if you had both. If you have health insurance from an employer health plan, retiree coverage, or Medicaid, and you sign up for Medicare, each plan is called a payer. When there's more than one payer, coordination of benefits rules decide who pays first. The primary payer pays what it owes on your bills first, and then sends the rest to the secondary payer or a supplementary payer to pay.
Thank you so much. This has been super helpful. So, when do we sign up for Medicare?
Well, it's your turn to sign up for Medicare during your initial enrollment period, or IEP. Your IEP is a 7-month window that falls around your 65th birthday. It's the 3 months before your birthday, your birth month, and the 3 months after you turn 65. If you're still working and/or have health insurance coverage through an employer or spouse's plan, you really should enroll as soon as possible. If you don't enroll in Original Medicare during your IEP, you may end up paying a permanent late enrollment penalty in the form of a higher premium that will last for as long as you have coverage. Also, if you don't have adequate prescription drug coverage and delay signing up for a qualifying prescription drug plan, Medicare Part D, you may end up paying a penalty.
Thank you so much, Mary. That's all the questions I have today.
Well, you are so welcome, Rose. Give us a call anytime.
Remember to like, share, and subscribe.
I just can't help myself. I'm gonna take one more call before lunch. Put it in the fridge, Carl.
Yep, you got it. All right.
Hello, thanks for calling Health Partners. My name's Mary. What can I do to make your day a little better?
Hi, Mary. My name's Sophia. I've got some questions about Medicare.
Well, I've got some answers about Medicare.
Okay, so I'm not really sure what all the different parts of Medicare mean.
All the different parts of Medicare? Well, that's as easy as ABCD. Let's start at the top. Medicare is broken out into 4 parts. Medicare Part A is for hospital insurance. This covers things like inpatient hospital stays, home health care, and some skilled nursing facility care. Part B gives you medical insurance, covering things like doctor visits, outpatient services, x-rays, lab tests, and preventive screenings. Part C is Medicare Advantage. Private insurance companies offer Medicare Advantage plans, also known as Medicare Part C. You're provided the same coverage as original Medicare, plus most plans include extra benefits and protection. And Medicare Part D is your outpatient prescription drug coverage. This all making sense?
Totally. So can you tell me more about Medicare Part A?
Absolutely. Medicare Part A is really all about hospital coverage. It covers inpatient hospital stays, home health care, and some skilled nursing facility care. It also helps with hospital-related expenses you may be charged, things like room fees, meals, and more. Part A also covers necessary medical supplies and drugs you receive at the hospital.
Got it. What doesn't Medicare Part A cover?
Medicare Part A doesn't cover doctor fees or hospital fees considered medically unnecessary, such as private duty nursing. It also doesn't cover personal care items like razors or the telephone or TV in your room, if charges apply.
I'd probably have my cell phone with me, I imagine. I'm not even sure I remember how to use a landline phone anymore.
Me neither.
So is Medicare Part A free?
Well, typically, most people don't pay for Part A if they have paid Medicare taxes for a certain amount of time while working. However, if you don't qualify for premium-free Part A, it can be purchased for a monthly premium.
Got it. I'm feeling pretty good about Medicare Part A. So can we go over Medicare Part B?
You got it. Let's keep rolling. Medicare Part B is coverage for medical expenses, like routine doctor visits, outpatient services, and some diagnostic screenings. Part B may cover some medication administered during your visit and a limited number of outpatient prescription drugs.
Is Medicare Part B free, or do I have to pay for it?
Most people pay a monthly premium for Part B. And when you need care, you're also responsible for deductibles, co-pays, and co-insurance.
Do I really need Medicare Part B?
The short answer is yes. However, if you have health insurance through your job or you're on your spouse's plan, you can delay Medicare Part B enrollment without penalty. Once neither one of you are on your employer's plan, you have 8 months to sign up for Part B. Also, you need to be enrolled in Medicare Part B if you want to sign up for a Medicare Advantage plan. There is a penalty for late enrollment in Medicare Part B that is 10% of the standard monthly premium for each 12-month period that enrollment is delayed. This penalty is permanent and can add up to thousands of dollars over a lifetime.
Why do they call Medicare Part A and Part B original Medicare?
Sophia, get ready for a little history lesson here. Medicare is a federal health insurance program that dates all the way back to 1965, when President Lyndon B. Johnson signed into law the bill that led to Medicare and Medicaid. The coverage you receive directly from the U.S. government is called Original Medicare, also known as Medicare Parts A and B. These 2 parts are the original parts from 1965.
1965? I think I was in grade school. I don't remember Medicare coming up in 2nd grade.
Sophia, I can hardly remember what I had for lunch today. Wait, that's because I didn't have lunch. Carl! Sophia, I have another fun fact for you here. When you're eligible for Medicare, you enroll through the Social Security Administration. This can be confusing for some. Don't go thinking that Social Security and Medicare are the same thing. They have key differences and eligibility varies, but these 2 benefit programs can impact each other. For instance, if you're already receiving Social Security benefits, you'll automatically be enrolled in Medicare.
Got it. But Original Medicare doesn't cover everything, right?
Well, Parts A and B, also known as Original Medicare, don't cover long-term care, also called custodial care, most dental care, eye exams for prescription glasses, dentures, cosmetic surgery, massage therapy, routine physical exams, hearing aids and exams for fitting them, concierge care, concierge medicine, retainer-based medicine, boutique medicine, platinum practice, or direct care.
Thank you. This is already so much easier to understand. So what's Medicare Part C?
Medicare Part C is also known as Medicare Advantage. These plans combine the coverage of original Medicare Parts A and B into one plan, which is pretty convenient. And they may offer additional benefits and perks, such as dental, routine hearing exams, eye care, travel coverage, prepaid flex cards, and most plans typically include Part D prescription drug coverage.
I do like the sound of extra perks.
You and me both, Sophia.
Is Medicare Part C a public health plan?
No, actually, it's private health insurance companies that offer these plans. When you join a Medicare Advantage plan, you still have Medicare. The difference is the plan covers and pays for your services instead of original Medicare. These plans are required to provide the same coverage as original Medicare, so you're not missing out on anything good.
So what does Medicare Part D include?
Part D covers your prescription drugs. If you're looking for an easy trick to remember what Part D is all about, just think D for drugs.
I like it.
Oh, and one more thing. You need to have Medicare Parts A and or B to get Part D.
And where do I get Part D for my prescription drugs?
Only private insurance plans offer Medicare Part D. It's usually included in a Medicare Advantage plan, or you can get a separate Part D plan.
So then what's the difference between what is covered in Medicare Part B versus Medicare Part D?
Though Medicare Part B covers certain vaccines based on health conditions and mostly covers medications administered during a visit, Part D provides a much wider range of coverage of vaccines and outpatient prescription drugs.
What vaccines does Part D cover?
Generally, Medicare Part D covers all commercially available vaccines needed to prevent illness. These are all the vaccines recommended by the CDC. Original Medicare only covers certain vaccines, like flu shots, pneumonia, hepatitis B, and some vaccines based on possible exposure, like rabies or tetanus.
How much do all these vaccines cost?
If you have Medicare Part D, you get all the recommended vaccines at no cost, including the shingles vaccine. If you have original Medicare, but not Medicare Part D coverage, you may end up paying full price for other vaccines you might need or want. And those costs can add up.
This has all been super helpful. I can't thank you enough.
Well, you are welcome, Sophia. Give us a call anytime, preferably 8 to 8 Central Time. Talk to you soon. If you're looking for Medicare help, there are tons of great resources out there.
You can read our Medicare blogs online.
Download informational packets.
Go to a Medicare meeting in person or virtually.
Or talk to a Medicare expert, like me or Carl.
Yeah, we're fun to talk to.
You know it.
Hey now. Boom. Yeah, remember to like, share, and subscribe.